Good afternoon. My name is David Blackburn. I'm your Bell County judge. Welcome to this press conference. We were advised yesterday that a correctional officer who works for the Bell County Sheriff's Department had tested positive for COVID-19. The total number of people that work in our jail facilities, the Sheriff's Department, and across the county for that matter, is around 1,100 people. We have requested a quick response force assistance from the governor's office to assist us in the testing and the assessments as we go forward. And I've got two other folks here that I'd like to introduce and let them provide some additional information to you. The first is Sheriff Eddie Lang, Bell County Sheriff. Sheriff Lang.
Well, thank you, Judge. I certainly wish I was here for a different reason than what I'm here for today. Yesterday at about 8:30 in the morning, we were notified of one of our employees testing positive for the coronavirus. And at that time, we began backtracking according to health department rules and recommendations. And it was determined that that employee had worked quite a bit the last 2 weeks, and not only in one position, but in a number of positions in and throughout our jail, including serving meals to our inmates. So, of course, we instituted different protocols to ensure the safety of our employees along with safety of the inmates. I want to reiterate at this time, there are no active corona cases in our employees and in our inmate population. Everybody is safe at this point in time, and we're trying to do everything we can to keep it that way. We also identified another employee that had possibly been exposed to the coronavirus through some community efforts, not anything at the jail. And we were awaiting a test on that employee, and I just received word back not 30 minutes ago that that test came back negative. But we do have one of our employees that did test positive for the coronavirus. Initially, we took precautions that were recommended to us again by the Bell County Health Department. Our employees were furnished masks and gloves. The mask wearing was voluntary at that particular time. We increased our cleaning procedures, both in our employee areas and in the jail area. Additional cleaning solutions were given to our inmates, and we did a really good job, I think, of keeping the virus out of our facility. And again, I want to reiterate, it is not in our facility at this time. And so we've done a great job, and kudos go out to all of our staff, our maintenance department, and even the inmates in keeping our facility free and clear of the coronavirus. But once we determined this employee tested hot, as the term is, and we backtracked and determined that his exposure probably came from another community event and not in the jail, we instituted protocols that were recommended by the health department. And that is masks and gloves, of course, made available to our employees, and it was made mandatory that anytime they have dealings with the public or our inmates, that all of our employees now have to wear masks and gloves. All of our inmates were given the opportunity to have masks supplied to them. As a matter of fact, if they refused to take one, we documented that just to prevent some further legal action. And we will continue to supply our employees and our inmates these materials until the health department assures us that everything is now safe to do without that stuff. See, what else do I need to advise you? We're working with our emergency management department along with the health department to ensure that we have enough supplies to continue this operation for at least a 2-week period and possibly even farther into the future. But when you're dealing with 1,000 masks a day, we can eat through a supply rather quickly. So we'll continue to work with this, and we'll have some other folks coming up explaining the procedures in just a few minutes. I had one question came through on the email, and it's what are the precautions we're taking to prevent the spread of corona? Well, again, we don't have corona in our facility at this time, and I've already explained some of the procedures that we had in place prior to this positive test, and I've also explained the procedures we now have in place after the positive test. This particular person says that inmates were only given a mask a day or two, and that's not correct. We've offered the opportunity now, and we'll continue to offer the inmates mask and we're going to exchange them one-on-one, whether it lasts a day or 2 days. We'll make sure that they have good, clean masks. And the rest of that, I believe I'm going to turn it back over to the judge. And if anyone has any questions, just let us know. Thank you.
Thanks, Sheriff. I'd like to stress a couple of things the Sheriff mentioned. One is that the Sheriff's Department had procedures in place prior to this one correctional officer testing positive. Those procedures included temperature checks of everyone coming into the jail. The procedures have been in place for several weeks, and I want to commend the Sheriff's Department for the work they have done to date, really to mitigate and really until this point in time, and still to this point in time, eliminate the presence of the virus in the jail and in the jail facilities and among our staff. So I want to say thank you to the Sheriff for the work that he and his staff and all of the correctional officers are doing day in and day out at the jail. The next thing I would like to do is introduce Dr. Chadwell, the director for our public health district, and she can provide you some information from the medical side.
Hello again. And the first thing I'm going to go ahead and go over is just with regard to the jail situation. I wanted to go ahead and give an overview of what's been happening since COVID started to impact Texas. Before we even had our first cases, Bell County jail administrators and Bell County officials reached out to us to start planning for the eventuality that they may have cases inside the facility and that they may have impacted staff at the jail that they needed to make plans for. So they have been very much on top of addressing this issue. And as a matter of fact, as the judge pointed out, they should really be commended for holding this off for 3 months. In a facility like a jail environment, it can be very difficult to mitigate these kinds of infections and mitigate this kind of spread. And they've, again, taken a lot of steps early on. They did not wait for it to be at their doorstep knocking on their door. They took steps very early, and I think that's a credit to them in this case. I do have with me here in the event there are questions about what we're going to be doing in coordination with jail facilities from this point forward, our chief epidemiologist, Gene McKeska. So he is here if you have questions that he should need to address. I'll let him do that. I don't have a lot for you for this particular event, but again, if we need to answer any questions, we're happy to do that.
Thank you, Dr. Chadwell. At this time, I'll go ahead and pause and see if there's any questions from the media that are online, and if so, I'll be happy to try to address those or direct those to the Sheriff or Dr. Chadwell. Any questions?
Hey, Sheriff, or hey, Judge Jacob from Telegram. I was wondering for the Sheriff, if they have any plans in place to start testing inmates just in case. What are those plans? What are those plans like?
I will address that. Yeah, I'll be glad to address that. Yes, we do. We have requested from the state task force to come to our facility and test all of our inmates and all of our staff members just to ensure and give them some feeling of confidence that we're doing everything we can. We feel confident that we don't have it in our facility, but that has already been requested. It has not been approved. I don't believe that they're coming, but we expect an answer from the state, hopefully within the next 24 to 48 hours, and hopefully get all of our employees and inmates tested within the 5 to 7 day period from the time of exposure. That answer your question? That delay is strange.
Yeah, and I mentioned the number earlier, 1,100, and that's actually the estimated number of people, both the Sheriff's Department staff as well as inmates, but it's well over, or we believe it'll be well over 1,000 people that potentially could be tested or need to be tested. Any other questions? If not, at this time, what I'd like to do is ask Dr. Chadwell to come forward also and address some questions that we received that are not necessarily jail related, but questions that have come in anticipation of our Thursday 11 a.m. press conferences, which this one will take the place of that. Tomorrow we won't do back-to-back press conferences. But we did get a few questions submitted for the press conference. So I'd ask Dr. Chadwell if she could come forward and maybe address those.
Oh, hello again. So for our update today, we have that pending, and I do believe the final number for Bell County cases today will be 263. And we're still sitting at 3 deaths. We haven't added any more to that tally. And we're keeping a close eye again on any potential spikes, any issues. But it seems like from our data so far, while we are seeing a lot of activity, it's been fairly level. But again, we're keeping a very close eye on that. The questions that I've received here, I'm just going to go through them one at a time. Why can't we get the number of tests done each day? The state provides those numbers, as do several counties. I would like to see the positivity rate and whether or not it's going up, staying flat, or going down. And that's information that's based on data that we do not house. And again, we're getting some reporting, DSHS data. I don't really, again, have the details. They started showing that by day, but that number is well below what we know is a true number of tests. And I can't speak to why that number is so low. It may have a lot to do with data processing, may have to do with facilities that are having trouble reporting to the state. Again, I can't speak to why that number is so low, but that is why I'm using that data and data from our hospitals. They may not get me the data every day. They do their best to do that, but it's difficult to have a daily tally every single day on top of everything else that we're trying to do. I'll endeavor to try and do that, but I can't make any promises as to our ability to do that with everything else that we have going on. Why is the first Golden Chick employee tested that was asymptomatic, and when was the second employee tested? So the first employee was tested as an asymptomatic for reasons that we do not yet know. It could have been an elective procedure or something like that. There's a lot of reasons why people might have been tested while asymptomatic. And as far as the second, the test was done, I do believe, on the 18th. We received the results on the 19th. And has anyone at New Beginnings tested positive? How many people were exposed? And are they all being tested? So we have an estimated number of approximately 250 with resulting from New Beginnings, because they house about 90 kids in the facility at any given time, plus employees, plus family members related to those children housed in the facility. And again, that's an estimated number. We have made contact with every single person that had a child in the facility. And so far, there have only been 2 positives other than the one that prompted the investigation. So that's 3 total for that facility. And we have made recommendations to anyone that does not currently have symptoms as to how they can seek testing should they develop symptoms. How many patients and staff at Bell County nursing homes have tested positive? I went through all of our data and I've noted 7, and that's staff and residents across the county in multiple facilities. So again, it's been spread out and sparse so far. And I'm gonna knock on the podium again. And for the next question, do you foresee a time when anyone who wants a test can get a test? Maybe. I can't make any promises. That is not up to me. That is up to those conducting testing, which are our facilities and the state, and that will be up to them to decide. I know that there have been some places that have decided to offer testing of anyone who wants a test, but I can't promise that will happen here. And the city of Belton is still planning to have a 4th of July parade, and I do believe that question was something that Judge Blackburn was planning to address, so I will let him take that one. I guess questions first.
Hey, Dr. Chadwell, it's Jacob.
Hi, Jacob.
There have been some reports about DSHS, including antigen and antibody results or testing figures as combined figure. Do you know if there's possibly a breakdown for our county, kind of what that kind of looks like for us?
So yes, so the way they've decided to do that, and I'm gonna try not to get into the nitty gritty with you, you have to ask the difficult questions. So they have 2 different case definitions. They have confirmed, which is that laboratory confirmed case. Now that's the only time we know for sure that we're looking at COVID-19. A probable case diagnosis, which is what you're describing, they're using antibody testing to say a probable, and they'll also use clinical diagnoses to say probable. It's kind of like the same thing we talk about when we talk about influenza-like illness. So those are getting logged as probable cases for a variety of reasons. We're not keeping strict tally on that because It's not very reliable. Someone with a clinical diagnosis of COVID could have about 5 or 6 other things. Someone with an antibody test, these are not strictly FDA approved. They're not considered very reliable. So again, it may not be COVID-19. So those numbers don't really tell you very much. And as a matter of fact, they're more confusing than they are helpful. I hope that helps.
Hi, Dr. Treadwell. It's Megan with KWTX.
Hi.
I have a question for you about the governor's announcement today that Bell County will be receiving one of the 30 drugs that he is giving out across the state. I was just curious of your thoughts on that.
I'm not gonna lie to you, I haven't seen that announcement. I've been kind of busy with all of this jail stuff, so I'm not sure what you're even referring to. I'm sorry. And there might be someone here who wants to address that. Dr. Greenberg, are you more aware of what's going on with that than I am? Nominated. Hold on just one second.
Hi, Bobby Greenberg with Baylor Scott and White Emergency Medicine. The drug you're asking about is Restimivir, and there are aliquots of that drug that are being sent out to certain hospitals and certain hospitals, not even hospital systems throughout the state. That process is still underway. I do know that some of the Baylor Scott and White facilities have been chosen to get small amounts of that drug, but each facility is only getting enough to treat a couple of patients. And again, this is all in progress and in process, and it's the same thing that's happening across the country. So we don't have all the details, but there are some of that drug that is being sent out to some of the facilities. While I'm here, you have any other questions?
Do you think
Yeah.
that it was needed here in Bell County?
So there's a fair amount of controversy. I wouldn't say controversy. It's not clear how effective that medication is. It does not seem to be harmful. And that's why it's a new disease, a new drug, and it's hard to see how effective it is. We have other treatments, mostly supportive, that we use for the treatment of COVID-19. So we certainly welcome having it, but it's not an essential thing that we have to treat our patients. Any other?
And I think you maybe addressed this. You guys were chosen to receive it, or do you know if Baylor Scott and White Temple requested to be one of the facilities to get it?
So like I said, I'm trying to figure out how to answer this the best way to make it not confusing. Essentially, everyone has kind of put their hand out or said, yes, we would be happy to have this medication. It's not available for everyone. And the process at the state level is to try to look at who probably needs it the most. So they're looking at facilities where they have the most number and the sickest patients. And again, it's an ongoing process. So we have definitely said, yes, we're interested in having it. I cannot tell you 100% for sure that Baylor Scott and White Temple has gotten that medication. I do know that there are hospitals within our system that have been told that they will be getting it, but I do not have a list. And again, this is information coming out throughout the day.
And then do you have an update on how many COVID patients are currently at your facility?
I do not have today's numbers. I will tell you that we have consistently been under 10 for probably the last month, with a number closer to 3 to 5 inpatients per day. And again, so some days that'll be the same person, some days somebody will go home and somebody else will be admitted. But our number of COVID-19 patients in our Temple Hospital has been stable for approximately the last month. Any other questions I can answer regarding the clinical care COVID-19 or Baylor Scott and White? Okay, thank you.
Thank you, Dr. Greenberg. Let me do a quick recap and then, well, actually, let me also respond to a question that Dr. Chadwell mentioned. And the question was, the city of Belton is still planning to have its 4th of July parade is the county working with the city to create social distancing guidelines. What I can say is I've had several conversations with parade and 4th of July organizers here in Belton. I would categorize the conversations so far as just that, planning conversations. It's my understanding a final decision has not been made, but again, planning activity and planning work is still ongoing right now. I think a decision on the 4th of July parade and festivities associated with the 4th of July probably will be made in the next couple of weeks or so. And again, I think some of that depends on the governor's next announcement, which I would anticipate to be sometime next week or possibly right after Memorial Day. A quick recap for today. We have one correctional officer in the Bell County Sheriff's Department who has tested positive for COVID-19. Due to the number of potential people that may need to be tested, we have requested the state quick response force assistance. We estimate perhaps as many as 1,000 people that may need to be tested as a result of this officer's positive test. It's an ongoing situation. We anticipate at least for the next several days, there will be work involved around the situation. One last thing I'd like to mention, and then I'll open it up for any questions you might have for me, is we do still have a COVID information line. That number is 254-933-5203. Again, that's 254-933-5203. Any questions I can address? All right. Thank you very much.